Hello, everyone. My name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference, and I'm very excited to have Dr. Jeff Dobro here, Chief Strategy and Innovation Officer at Transcarent. Welcome, Dr. Dobro. How about we get started with some brief introductions?
Great. Thank you so much. It's a pleasure, and thank you so much for taking the time to do this interview today. As you said, I lead strategy and innovation at Transcarent. We'll get into what they do probably a little bit later. But from an introduction perspective, I was recently leading strategy and innovation for the health group at Mercer, which is just a big national or really global consulting firm. And prior to that, I had a few other interesting positions. I was the chief medical officer at one medical group based right there with you in San Francisco, and then actually led the clinical services and innovation and product design for RedBrick Health. Then RedBrick, strong behavioral and mental health background, really thought a lot about how people behave around their health. That was a really interesting position. And then before that, actually was at Willis Towers Watson, working with large employers around their medical issues, on-site clinic issues, and a lot around the behavioral health and mental health issues. Thanks for having me today.
I have to ask, what motivated you to leave the consulting side business after 20 years of being there to join Transcarent?
There's so many amazing things that you can do as a consultant. You really get a very broad view of what the health issues are. My area of consulting was all around health, mostly working with self-insured employers. So incredible breadth of exposure to really interesting people, great ideas. In the consulting world, it's pretty interesting working with self-insured employers. It's an interesting space around innovation because for that kind of an employer, it's because of ERISA, they have the right to design programs as they want. It's their money, their people, and they get to make the design choices. So when you're working with a group like that, you can say, gee, I see a problem with whatever. It could be, teen mental health, and you get to do the work and identify the issue. And then your client gets all excited and it's like, okay, let's come up with a solution. But now the solution set is just whatever exists in the market. It can be a little bit frustrating because I have some really interesting ideas. Others have interesting ideas about new, better, different ways of doing things. And you can't make the market do what you want to do just because you're the consultant. So there were so many different new, really interesting ideas that we were trying to promulgate at Mercer, yet there really wasn't anybody in the market delivering them. So I said, all right, you know what? This is a really unique time in America. The financial pressure on employers and on the health system is immense. The technologies that have been developed are incredibly better than they were before. I've been thinking about these kinds of things for 25 years now. So with the tools that we have, the ability to capture data, use data, think about machine learning, artificial intelligence. So the whole data system has changed. The whole informatics system has changed. The perspective from employers, from purchasers, they're willing to try all sorts of things that they weren't willing to try before. And in fact, COVID has made that even more of an issue because companies, for the past year in 2020, the big question was, gee, now what are the cool things we can do for our employees? It's like, do we have any employees? Is anybody coming to work? Do we actually even have a business? And now we're coming out of that. And that happens to make this, 2021, 2022, and 2023 really unique. And then the last thing that changed is the provider system is really changing, whether it's in the field of mental health or medical care or cancer or surgery or whatever the specific area is. Providers, the doctors in the hospitals, they know they need a change. You start to see this in the conversations, the conferences, the literature. I'm a doctor, so my friends are doctors. I hear about it from them. So everything is in place now that, if we have a chance to do something that's really different and better, this is at least to me, it's like, okay, I want to give it a shot. And that's why I left.
For those in the audience who aren't familiar, what is Transcarent and your mission?
Oh, really interesting. So Transcarent is a pretty new company, really just launched last year in 2020, in the middle of COVID, trying to put these ideas together. But what we're doing at Transcarent is trying to face some of the really complex problems that regular old people, consumers, patients, we happen to call them members. We know that the day-to-day experience is really confusing, is way too complicated to figure it out, and it's very costly. Well, those are not a recipe for success. So we're doing two main things. One we're doing is we're trying to create a great experience for people so they get unbiased information and trusted guidance from us through some great digital tools. And we have human guides, just a person that you can talk to essentially help you figure out what your problems are, where to go, what's the next best step. Like, how do I make my way through this crazy system? And then the second piece is we're very heavily focused on value-based care, recognizing there's a lot of waste in the system. I mean, this has been documented forever. I don't remember the number. Was it like $3.8 trillion, I think, is the total healthcare spend. And roughly 30%, maybe more, some people claim, is just wasted. I mean, it's not helping anybody. So as a doctor, like, why would I want to put somebody through a surgery or a medicine or a test or whatever if it isn't going to help them? So we've worked really hard on identifying whether it's the right place to get your care or the right test or the right doctor at the right time. And then we are actually contracting with the providers, with hospitals, with surgery centers, with primary care groups, you can name it, throughout the entire ecosystem, to create what we call value-based care. It changes the payment system. So we're hoping to take away that incentive to just churn lots and lots and lots of visits and tests and things that are not likely to actually help anybody. So we're focused on quality first. We want really high quality providers in all fields. And we'll talk a little bit about the mental health field, I know, a little bit later in our discussion. But through all fields, like, how can we just do better? How can we get better results for people and actually avoid all that waste and get better pricing, which is for another day. We can talk about, the craziness in the pricing system in America in healthcare. But that's what we're doing. So it's taking a good experience or creating a great experience, helping somebody make their way through the system, and then linking them up and taking them through that care experience so there's a much higher value driven by actually the provision of care itself. That's all. We're just like transforming the entire healthcare system.
Yeah. I was just going to say, I mean, given the amount of choice, it's just so overwhelming, and this could be really quite game changing. So yeah, why don't we jump into behavioral health a bit? What trends have you seen in terms of employers' focus on behavioral health offerings and how or whether to offer such benefits to their employees?
Sure. Having been on the employee benefit side for a very long time, way before COVID, there was definitely a growing trend to pay more attention to the mental health of their own employees. I mean, it directly affects how their company is working. And employers have recognized that there are just really big behavioral health issues. It's just big. COVID has made this so much worse with depression, anxiety, and loneliness. And we'll talk a lot maybe later about the deaths of despair, which are not related to COVID. These are issues that have been growing in our society for a long time. And just like it's reflected in the general society, it's reflected in the employee population or in their families. So it affects how people are productive at work. It affects costs. We all know that behavioral health issues just make comorbidities worse. If you have heart disease or diabetes or cancer, if you're also depressed and anxious, it's that much worse. I happen to be a rheumatologist by training. So most of the patients that I've had have chronic conditions. And just before I got very sophisticated in actually screening people using real screening tools, it was just apparent to me that a huge number of my patients were depressed. huge percentage of them were really anxious and they didn't know where to go. So when I was in practice, this was quite a while ago, I ran kind of a combined rheumatology primary care practice. We brought mental health specialists in. We had therapists that were part of the practice. Because I'm thinking, I don't know what to do for you. I mean, I can talk to you, but I'm not a professional in this area. So we brought in professionals. And I will tell you, Salome, sometimes, actually probably a lot of the time, the therapist was a lot more helpful to the patient than I was. I mean, I could help them with the medicines and side effects and exercises and things like that. But their day-to-day well-being had such a huge behavioral overlay that it didn't really matter how good the medicines were working for them. Their chronic pain was as much, a mental health issue as it was a musculoskeletal issue. And anyway, so building that kind of collaborative model was incredibly effective. And that's been a model for me that's been important ever since then. So you were asking about employers, whether it's our observations or mine personally or Transcarent's. You can even look at the survey data that's come out of Willis Towers Watson or Mercer or Aon or others. Behavioral health issues have been in the top 3 considerations. And in the top 3, not only is it something to worry about, it's something to do something about for quite a while now, for at least the last 5 years. I would say the last thing on that topic is, decades ago, employers thought putting in an EAP program that was like, check the box, done with that. No one has any more, issues. Access is solved. We're done. 3 visits, we're done. And that's it, right? But that clearly was not the answer. And that's not to in any way discredit the value of EAP programs, but it was an insufficient answer to the problem.
You alluded to the pandemic, which of course has a huge role in all of this. As a physician, what is your perspective on behavioral health technology fitting into the experience of the past 18 months, COVID-19, and really returning back to normal life?
That's a really big question there. So, if we think about what some of the issues are in general around behavioral health and people's, what's the gap between what we need as just human beings and what's available? One of the biggest issues is first knowing that you have a problem. And I see a huge benefit in some of the digital tools and just identifying and specifying what risk is. And we've seen some great tools in the market. There are some that we'll be bringing in to our program. And then a second really big problem is just access to a trained human being, like a professional, whether it's a coach or a therapist or psychiatrist or somebody who can help an individual. If we're relying just on face-to-face care, there are a lot of problems there that can be really helped a lot by these more novel digital solutions. So it's plain old access. Maybe it's just, a standard 45 or 50-minute visit with a therapist, but it's now over video because people during COVID weren't going in. They just weren't seeing anybody face-to-face. We've also seen that really nice growth in the actual digital therapy tools. I mean, that's not exactly the right phrase, but whether it's CBT or some of the other methods, seen really nice solutions growing. And when people couldn't get access in any other way, this was a really terrific solution, and it still is. And it's one that we see tremendous growth in the future, more creativity, connectivity, maybe into telehealth, typical episodic telehealth. We can go into that in a minute, but we have a really interesting program going on with Cirrus MD. They're actually our telehealth partner on screenings and identifying risk, and then guiding people. That's that larger principle that we have at Transcarent, guiding people to whatever the right digital or maybe even a human solution. But I think about access screening and just a new way to help people that was probably not widely enough used prior to the pandemic.
Do you foresee a change in the way behavioral health is treated in the benefits space? both for employees and employees, as both cost and need factors remain concerns to be balanced?
Absolutely. The idea that that mental health, behavioral health really is at parity with what we will call maybe physical health. I don't like that distinction. I really don't. But from the benefits world, the type of provider and the diagnosis code make a big difference in how a benefit is structured and how payments are made. And they're just not treated the same. I know parity is supposed to have happened a long time ago, but it really just didn't happen, or really hasn't happened to the degree that it has. I think the post-pandemic pressure to recognize and support people around their behavioral health issues, this is what I've heard. It's really driving what I'll call true parity, that the benefits are really going to be equal, the payments are. And outside of a traditional health benefit structure, we're also seeing a lot of interest in, I'll call them supplemental behavioral health programs that are paid not necessarily directly as like a claim through a typical insurance claim, provider process, but these digital tools, the screening tools, and even some of the things like telehealth, whether it's video, phone, or even some in-person kinds of benefits, are being added to the traditional program, the traditional health plan, to help supplement some of the gaps and some of the needs that we've just talked about. What's interesting also is some new solutions thinking about like what exactly even is in-person therapy or teletherapy, person-to-person therapy. Much of it is designed around what I would call a traditional 45 to 50-minute session. I don't know who made that up. Like, how did 50 minutes become like the quantity of face-to-face time that was needed to help somebody feel better or understand their issues? So we're seeing some really interesting alternative models, maybe 15 minutes. Well, that doesn't even cost so much because, you're allocating professionals' time. It's certainly not the standard way of doing things. The whole idea of self-service CBT, or as we've talked about, digital therapy, completely different. It doesn't fit. Like, there's no medical claim for using a CBT-based app. Combining those together, or thinking about maybe how coaching for lower acuity, or stress coaching for lower acuity, resiliency training for people with all sorts of issues that may not rise to a formal diagnosis that needs lots of face-to-face time. So we're seeing the combination of all these different assets coming together and solutions, and then the payment structure has to be there to support all of it, whether it fits within a traditional health plan framework, which is more around, PhD therapists and psychiatrists doing their thing, or investment in some of these alternative solutions and combination solutions. We're seeing a lot of interest in that.
So the Wall Street Journal recently wrote this. It seems like employers are now faced with the growing challenge of offering dozens of digital health point solutions, specifically in behavioral health, but now are challenged with attempting to provide a better experience for their employees that results better clinical and ultimately financial outcomes. So, Dr. Dobro, would you agree with that? And how is Transcarent addressing this?
Yeah, it is it's a big issue for employers. As we know, there's a wide array of behavioral health issues, and there's a wide array of potential solutions. There is not one answer that we push the magic button and everybody's mental health gets better. So the good part of that, or the good thing, is that there are a lot of innovators, a lot of really interesting people trying to come up with a different solution. But a lot of them have addressed one small piece of this. So there are solutions that look at just risk identification. So there's a lot of educational, maybe there's some guidance-based services. There are a lot of digital CBT type apps or other methodologies. Then you see the telehealth companies, and then you see help you find somebody. It's an access or a quality based. So those are all good solutions, and we've seen this happen in other areas of employee or employer health. But from the perspective of the poor human resources people that are in charge of their health plan, it's an explosion of ideas. And it's great from the perspective that they get to think about all these great things that they could be doing and how on earth would they put them together. But it's impossible, really impossible. It's very frustrating for the HR teams, the human resources teams, to make sense of all of this and construct a logical program that's both accessible, it's getting the outcomes they're looking for, it feels integrated. What would happen if now we've got a screening program, but then that's got to send me to the next vendor, the next solution to somehow figure out which digital therapy is best for me, and that's competing with my teletherapy. It's like, oh my goodness, I don't know what to do. So that's from the employee's perspective. And then from the employer's perspective, they have to be able to manage all of these different relationships. So I'll say this, a few things that have happened maybe over the last year or two. So first, on the vendor side, on the supplier side, some of the better companies that provide behavioral health solutions have started to expand horizontally to offer more solutions. So it's more of a full package suite of behavioral health solutions. But that still doesn't address the problems. How do we get people to know about these? How the employees and their families know what to do? So we're taking that next step. I think, as I alluded to in the introduction, we want to make it easy and simple and just very streamlined to figure out what the right thing to do is. It's just a person, as your everyday person who's not thinking about the complexities of the constructs of the healthcare system. Just, I don't feel right today. Help me. That's really is about sophisticated as it gets. So we are, including all of the other components that we put together in Transcarent, we are heavily focused right now on end-to-end integrated behavioral health solutions, including the telehealth. I might have mentioned the program we put together with Cirrus MD, which then links together with the rest of the solution. How do I find longitudinal behavioral health? Like, who do I talk to? Can you get me a therapist, or maybe a coach, or maybe I need my medicines adjusted? All of that is coordinated in our system. All of the pieces are connected to each other. It's driven, if you need a human being to help you figure this all out, by our health guide. And then we try to make it more of a one-stop shop for the human resources person on the other end who used to be my clients. And we would sit in these meetings and they're just going crazy. It's like, hey, Jeff, you got to help me. There are like 18 different solutions that kind of fit my issue here. Like, what do I do? Could we get it from 18 even to 4 or 3? Or maybe one day it could even be 1. And that's what we're trying to do, remove that friction for our clients, for the employers. It's very hard to do. We have a long way to go, but that's what we started doing. And that's what our goal is in this space.
So with these conversations with all of these employers, and then of course in your own experience, can you give us an idea of what are some key metrics that are really top of mind for them as you're helping them with these explorations?
Sure. So, some of the easy metrics are being able to identify that their employees actually have these issues. We've all read the literature that many people just walk around with mental health issues, whether it's anxiety, depression. We talked about loneliness. So there are scales that there are measurement tools that the employers are interested in. They may have us do this, or their well-being vendor, or it's part of maybe a health risk assessment. They're just trying to quantify how big is this problem. And then they're looking to see, gee, if these folks who have these issues, are they then availing themselves of any of the solutions at all? And then once they're in whatever the program may be, there are tool sets to assess whether someone has a problem, how severe it is. You're very familiar with the GAD and the PHQs and some of the other tool sets. So they are looking for incremental improvement to demonstrate that there was an impact from that program. Somebody, whatever their diagnosis, anxiety disorder, did they get any better? Or is there a resiliency scale that they can look at? So they are looking for objective improvement. And then they're looking for financial improvement by impacting the mental health of these particular people. Did somehow did their overall costs go down? Or did their maybe their engagement or their accountability around other conditions, as we talked about comorbidities, like, if they're looking at a group of people with diabetes who may also have depression, did their diabetes get any better? And it does, or at least it should if the program and the right initiatives are in place. And then from a population perspective, they're always looking for evidence, and this is more on a national basis. Did things like death rate get better? Did overall identification get better? Are the rates of these particular conditions getting any better at a large level? And then they're also benchmarking against other companies like them and other employer-based programs. Are they getting better or worse relative to others?
You mentioned well-being vendor earlier. Have you heard much about, or what's the perspective you're hearing on the difference between mental illness versus mental wellness, for example?
Oh yeah, really different, right? I'll share with you. So when I was at RedBrick, we ran what we called the Stress and Resiliency program because people didn't want to say, I'm depressed. They don't want to hit the I'm depressed button, but they are very happy to say, I'm stressed, or I would like to improve my resiliency or my mental well-being. And I'll share with you also, that was by far our number one subscribed program, by far. And this was, I haven't been there for a few years, so it's long before COVID. And what was very interesting about that was it was a gateway to start to talk about just how people felt about their life, how they then felt about their health, and then get them to take very specific steps about their comorbidities, their blood pressure, their diabetes, their heart disease, or whatever. So, when we think about mental well-being, it feels more like strengthening how I feel about myself. How am I able to deal with the stresses of the world? Mental illness, and maybe this is just my perspective, is at that's really a higher acuity, more condition-specific kind of an issue. And around mental well-being, we don't really think about medicines, necessarily for that. Around some of the more serious kind of conditions, we do, and look at guiding people into the right place to get those issues taken care of for themselves.
So I understand that difference, but how are employers viewing payment for these different things?
That's a really important distinction. Payment for mental illness falls within the medical plan. I know earlier we were talking about parity, which is not at parity, and dealing with the issue of access, just get to the right level of care, because these are serious issues. I would say that employers are following the lead of the health plans, the health insurance companies, although they are pushing for more parity and equality around benefit design, which they have control over, and then payment levels to the professionals, which they rely on the health plans to take care of. And they recognize that the professionals are really, they're not paid enough, or at least they're not paid enough as part of the health plan. And that leaves large out-of-pocket costs to the person. In out-of-pocket costs, especially in a stressed economy like we have, where, you see a lot of people who are just not doing well off. We know average wages have not gone up in decades. This is my personal perspective, but we're seeing a shrinking middle class. Everything, financial, people are under a huge financial strain. And if they're not perceiving that they are physically at risk, maybe of dying or being in terrible pain, they're not willing to get treated for their issues or even find out that they have them. Also, this is a little bit of a tangent, but it's, I think, somewhat related to this, and it was an eye-opener for employers. So last year when I was at Mercer, we did a study in the middle of COVID to look at the new diagnoses of different kinds of problems, to see if people somehow weren't getting diagnosed and were they being screened, what was going on. And in an array of other issues, we looked at new diagnoses of a wide array of mental health issues, all the way from low level, low acuity, middle acuity, and some really serious, like looking at schizophrenia and bipolar, and some of these are really debilitating conditions. All of them, new diagnoses way down, meaning people were just not coming into the health system. They weren't getting the support they needed. And when we shared that with employers, at least the employers that I was working with, that was a real eye-opening moment. The way that we presented it is we're now showing you not only are these conditions generally under-recognized, now that people are not engaging with the health system of whatever that may be, they're very, very underdiagnosed. This is going to come back and hurt all of us when people start to now engage back in the system and engage with their peers and back in their job or with medical professionals. We are going to see a huge jump. We'll become aware because of the underdiagnosis, the basic issues that we talked about pre-COVID, where people were stressed and lonely and depressed. Post-COVID, there are so many big problems that people are going to have to address. We're going to see a big spike. We just want to let you know to anticipate this. In your benefit design, please bring people in, bring more of these kinds of programs in so people get help. We're not somehow creating thousands more therapists every year. They just don't exist. The demand is there. So how are we going to be using digital solutions, more efficient solutions, more creative ways of interacting to get people the care they need? And employers are pretty receptive to that. And to one of the earlier points we were talking about, if they had to set aside a new kind of a budget through whether it's a well-being resiliency program or funding telehealth in a different way or bringing on board and paying for some of these digital solutions, it was a pretty receptive audience, even in a financially strapped time, which hopefully, now we're coming out of it, we'll start to see more action.